me, Auntie Ness, on Heal TV, whilst we discuss health conditions, their causes, management, and prevention for a healthy living. You know your health is your wealth. Stay connected, stay informed on your health. Only on Heal TV. Heal TV, proclaiming Jesus Christ in good health.
Stay Healthy with Auntie Nurse shows on Sundays at 4 p.m. and repeat on Mondays at 9 a.m. on Hill TV, a multi-TV channel, Hill TV proclaiming Jesus Christ.
Join me, Auntie Ness, on Heal TV, whilst we discuss health conditions, their causes, management, and prevention for a healthy living. You know your health is your wealth. Stay connected, stay informed on your health. Only on Heal TV. Heal TV, proclaiming Jesus Christ in good health.
Stay Healthy with Auntie Nurse shows on Sundays at 4 p.m. and repeat on Mondays at 9 a.m. on Hill TV, a multi-TV channel, Hill TV proclaiming Jesus Christ.
Join me, Auntie Ness, on Heal TV, whilst we discuss health conditions, their causes, management, and prevention for a healthy living. You know your health is your wealth. Stay connected, stay informed on your health. Only on Heal TV. Heal TV, proclaiming Jesus Christ in good health.
Stay Healthy with Auntie Nurse shows on Sundays at 4 p.m. and repeat on Mondays at 9 a.m. on Hill TV, a multi-TV channel, Hill TV proclaiming Jesus Christ.
Join me, Auntie Ness, on Heal TV, whilst we discuss health conditions, their causes, management, and prevention for a healthy living. You know your health is your wealth. Stay connected, stay informed on your health. Only on Heal TV. Heal TV, proclaiming Jesus Christ in good health.
Stay Healthy with Auntie Nurse shows on Sundays at 4 p.m. and repeat on Mondays at 9 a.m. on Hill TV, a multi-TV channel, Hill TV proclaiming Jesus Christ.
Across the globe, welcome to Stay Healthy with Auntie Ness on Heal TV. Heal TV, proclaiming Jesus Christ in good health. Welcome to today's program. We are discussing menopause today. We've heard of menopause, a lot of us, but we do not know much about it. So today we are coming to discuss what menopause is and then how to
to manage it. What exactly is menopause? Menopause is a word that comes from Greek. We have the mens, which means monthly, and then we have palsy, which means stoppage or cessation. So menopause is cessation of menstruation, okay? It is just a part of the woman's aging process. As the woman hits 40 going, then she starts aging, okay? In the sense that her hormones start reducing because the ovaries that produce the hormone start shrinking. So it affects the production of hormones in the body. So permanent cessation of menstruation, like your menses or your monthly flow, for 12 months consecutively, we can diagnose that as menopause. So what are the phases of menopause? We have about 4 phases. We have the pre-menopausal phase. We have the perimenopausal phase. We have the menopausal phase and the post-menopausal phase. They all have slight uniqueness. The pre-menopausal phase usually occurs around after 40 years going. So there is slow degeneration of the ovaries that produce the hormones. Then the perimenopause period, that is when you will see marked symptoms. Your body organs start manifesting the reduction of estrogen in the body. The woman will feel it and start complaining about it. Then we have the menopausal phase, and then that occurs usually between 45 and 55 years. However, it is also peculiar to the family you come from, because in some families, the women go into menopause early, like 45 going, they hit it, but others to cross 50 before they start experiencing menopause. That shows us the uniqueness of the individual or the families. Yeah. So, what are the causes? Like I said earlier on, when your eggs are depleted, progressive depletion of your eggs, it is difficult for it to produce the hormones that you need. The hormones, we call them estrogen and progesterone, to menstruate monthly, because that's what regulates our menstrual cycle. Those 2 hormones regulate our menstrual cycle. So if they are reducing due to age, or as a result of the woman aging, then it affects your menstrual flow. So progressively, you start reducing menstrual flow. Even when it comes, as for instance, if it's 5 days, it may reduce to 3 days, or the flow will not be that heavy. Or for some people who have light menstrual flow, it may be heavy. And others too, the duration may shorten. Maybe it's 1 week, it will come to 5 days, come to 3 days. Some months it will not come at all. That's when you start entering your menopausal phase. So what are the changes that you see, that happen in the body? The changes are grouped in physiological changes. Those are changes that you feel in the body, the woman will tell you about. And then we have the physical changes that you see, and then so on, social changes. So let's say the physiological changes. You have your cholesterol increases because of reduction in estrogen and progesterone. It tends to increase your cholesterol levels. And then you start having bone crisis. Mostly you see the women at that age will start complaining of joint pain, especially knee pains and all that, because the calcium, the estrogen reduction also reduces calcium production in your body. So it causes your bones to be brittle. And then, you know, that's how come you experience osteoporosis. Digestive system. You see that estrogen is what gives helps the lining in the stomach. You know, it helps in digestion. So if it's, those hormones are reducing, then affect your digestive system. Your urinary system too. When you are, the linings that line your urethra. Urethra is the tube through which you pass urine. That lining sort of dries up, you know, it shrinks. So it doesn't give that lumen the elasticity it deserves. So you see that within your bladder, the woman will start experiencing frequency of menstruation, like frequent urination and other things, other urinary symptoms. Because it is lax, it is prone, the woman is also prone to infections through the urethra. Then we have the changes in the woman's reproductive organs. Like the uterus will shrink. Menopausal women have, their uterus shrunk. It becomes small. Their reproductive organ, like the vagina, the outside wall, you know, when you are young and bouncy, so to speak, it is full. The whole place is full. Your labia majora and then minora is all full. But when you go into menopause, it also sort of reduces in size. Your vagina itself becomes dry because the lubrication that is caused by production of the hormones, such hormones, is reduced. And to reduce till it is reduced. So that causes very dry vaginum. You don't produce enough secretions. So that also affects the woman's sexual life most of the times, yes. And then we have the vulva. Okay, we talk about the vulva. We have the breast changes. The breast, women who are cute in nature, will have their breast flat because the tissues are, they have that kind of round look because of the estrogen. It has that feeling. It retains water in the body. So it helps retain water in the body fulls. But once it's dwindling, your breast becomes flat on the chest. Women who are chubby and fat, you see that it is, we call it pendulum. It is pointing like this down. That's what happens to their breast. So what are the general changes you see in the skin? The skin of the woman becomes very, very, very thin. The elasticity is gone down. So you will see that smooth skin, as you see in the younger women. You will see dryness and wrinkled skin. Those are the effects of reduction of hormones as a result of menopause on the woman's skin. You see that woman at the menopausal stage tends to put on weight. Yes, especially around the waist area. The buttocks, the hips, I mean, they become rounded. So that is one thing we should note. And then the voice too becomes sort of deep. Their voice becomes also deep. Then we have hot flashes. That's the main symptoms that people complain about. That in no time, maybe within a day, you become hot. Very, very, very hot at a point in time. You want to take off your dresses and feel good. You need fan to feel comfortable. Then in no time, you become cold. Those are the main, one of the main symptoms that, the changes that you see in menopausal women. And then night sweat, you sweat a lot in the night. So most women tend not to even wear clothes when they are sleeping at night. Yes. Then we have psychological changes. Under the psychological changes, the woman becomes easily irritable. Easily irritable. The least thing puts the woman off. The woman have headaches, experiences fatigue, easy fatigability. The least thing she does, she becomes very, very tired. And then also sleep disturbances. Sleep disturbances is mostly due to frequency in passing urine and also the heat that the woman experiences, sweating at night. So it disturbs the sleep of the woman. All this as a result of changes in the hormonal production, the decrease in the hormone production. Socially, the woman loses self-worth, like her image. She feels that something has changed about her. Imagine, you know you are aging, all right, you have hit menopause. But you look at yourself in the mirror, you see that the breast that once used to be full and then you hip. Now you cannot, it's not hippable. You cannot hip it. Yes. So you tend to feel worried about your appearance, and then it can also lead to depression. Yes. And then you are conscious. What do people say? So you see that menopausal women are very, very sensitive with comments that people make. Maybe can't you see you're old? Why are you wearing this and that? Those things affect their self-image. Yeah. So how do we manage or treat the menopause? Usually it is treated symptomatically. So the symptoms that you present, the money is managed as such. So it is advised, mostly lifestyle changes. So instead of wearing heavy clothes, heavy nightwears to sleep, this time you are advised to wear light cotton dresses, very light dresses, so that air can pass through and make you feel comfortable. You also avoid the intake of caffeine, coffee, hot coffee and all that. Intake of alcohol, reduce it to the barest minimum. You also reduce spicy food, You reduce the spice that you add to your food. Yeah. And then the fat that you add to your food, the trophies, the fast food, those fatty foods, you have to reduce it to the barest minimum if you want to live comfortable life during your menopause and post-menopause. You also do regular exercises. So we are managing symptomatically regular exercises so that you do not put on so much weight that will affect your health later. It is advised that you take calcium, your food rich in calcium and vitamin D, and also magnesium. The dairy product, the milk, the meat, the green leafy vegetables. Those ones give, the seafood, crabs, produce calcium. Then you can also support it with your supplements. That will help you to manage your bone symptoms. Yeah. There is this thing we talk about, Kegel exercise. Kegel exercise is good for the woman's birth canal, like the vagina. Yeah. It's very, very good. Urethra, when you're passing urine. It is done this way, that when you feel like weeing and you sit on you are passing urine, you don't pass all the urine at once. So you pass the urine in bits. You pass it in bits. When you pass more, you hold onto the urine for some time and then pass the rest and pass it in bits like that. You pass, you hold, you pass, you hold. It's an exercise. So with time, without the urine, even in your sitting posture, you can hold onto your perineal muscles. You hold onto it, you release. You hold onto it, you release. It helps tighten you and then also position you to enjoy sex. Yeah, thank you. So, and then the intake also of vitamin E. Vitamin E is a sort of lubricant. It works on your skin and even on your linings. Flaxseed oil. Flaxseed oil that you can get in poultry, in meat, in red meat. Yes. That will help in maintaining your hair. So that your hair will not fall out. Your skin will look healthy. Those are the management by symptoms. Those are the management you can use to manage your symptoms and live a comfortable life. But in cases that you can't, you just can't handle the symptoms. There are women who cannot just handle the symptoms. So those women are put on the hormone replacement therapy. We call it HRT. So it is like a synthetic hormone, estrogen and progesterone, that you are given. It comes in various forms. It can come in tablet pills, form that you take by mouth. It can come like a patch. You just place it on your belly. It can come like a cream you rub in your vaginum or wherever you are asked to rub it. So that's how. So it replaces the hormone that you are losing because of, or you don't have because of menopause. So it helps you to function properly. Okay. So indication for that hormone therapy. The hormone therapy, what is the indication? Osteoporosis. When you are giving the hormone therapy, those bones, pains, and things stop. It also relieves most of the symptoms that you may present with, and helps the woman to maintain quality life during the menopause time. However, it should be prescribed for women who also experience premature ovarian failure. For instance, it could be due to some health issue. The woman will not be able to produce hormones. So those women are put on hormonal therapy, replacement therapy, and other conditions. Some people to maybe radiation. You might have some chronic conditions like some cancer of the breast or something that you go through radiation that will affect your menstrual cycle, will affect production of estrogen and progesterone. So you'll be put on hormone replacement therapy. There are several types of hormone replacement therapy. We have the estrogen and progesterone, which is we call combined therapy because it combines both hormones. Yeah. That one is designed for women who have uterus. Yes, women who have uterus. Those ones, the estrogen is given regularly, like for at least 25 days. Then it is supported with the progesterone for the last 12 to 14 days. That is done so that the woman will not end up having endometrial cancer, because prolonged use of the estrogen alone can predispose the woman or cause the woman to have endometrial cancer. That's how come it is managed if the woman has uterus. It is managed by giving progesterone at the latter part of the cycle. Yeah, thank you. So estrogen only. We talked about two, the combination therapy and the estrogen only. That one, if the woman doesn't have uterus, she might have lost the uterus maybe during surgery. They might have done hysterectomy and taken out the uterus. So surgically, she goes into menopause. Such women are given estrogen only therapy. However, progesterone only sometimes can be given to women who are experiencing hot flashes, uncontrollable hot flashes. So one may ask, how long should we use this hormone replacement therapy? It is to be used in a short time of between 3 to 5 years. Prolonged use will give the woman health issues, predispose her to cancer of the endometrium, of the breast, and all those things. So it is advised that within 3 to 5 years, by which time the symptoms might have even subsided, it has to be stopped. Yeah. So that's all about the menopause we go for commercial break. Thank you.
Join me, Auntie Ness, on Heal TV whilst we discuss health conditions, their causes, management, and prevention for a healthy living. You know your health is your wealth. Stay connected, stay informed on your health. Only on Heal TV. Heal TV, proclaiming Jesus Christ in good health.
Stay Healthy with Auntie Nurse shows on Sundays at 4 p.m. and repeat on Mondays at 9 a.m. on Hill TV, a multi-TV channel, Hill TV proclaiming Jesus Christ.
What you went through to builds you up, gives you the mechanism to maintain it.
There's a spiritual word that also attacks.
They didn't love me as they are supposed to love me. And he came in and he taught me how I'm supposed to be loved.
Be inspiring, it's going to be encouraging, it's going to motivate you, and I believe it's going to be a thought-provoking one. My name is Pastor Niamat, and I'll be bringing your way the long-awaited TV show program that you've been waiting for. It is dubbed Unashamed. It's going to be inspiring, it's going to be thought-provoking. Now, this program is going to bring great men and women of God and also businessmen that have made impact in various ways that we can ever think of. They are bringing us their true life stories, stories that can inspire you, stories that can change your life. And trust me, they're bringing their true life story to our doorstep. This story is going to motivate you, it's going to let you know that you can definitely make it. Now, this is going to happen every Wednesday from 5:30 p.m. to 6:30 p.m. Myself and my guest will be talking about their life stories on Hill TV. Don't change the dial for anything because we always proclaim Jesus Christ. Tell a friend to tell a friend. It's Unashamed, inspiring you. See you.
Unashamed shows live on Wednesdays at 5:30 p.m. to 6:30 p.m. and repeat on Thursdays at 8:30 p.m. to 9:30 p.m. on Hill TV, a multi-TV channel, Hill TV proclaiming Jesus Christ.
Join me, Auntie Ness, on Heal TV whilst we discuss health conditions, their causes, management, and prevention for a healthy living. You know your health is your wealth. Stay connected, stay informed on your health. Only on Heal TV. Heal TV, proclaiming Jesus Christ in good health.
Stay Healthy with Auntie Nurse shows on Sundays at 4 p.m. and repeat on Mondays at 9 a.m. on Hill TV, a multi-TV channel, Hill TV proclaiming Jesus Christ.
This is Hill TV. You are watching Stay Healthy with Auntie Ness on Hill TV. Today's discussion was on menopause. Yeah, we talked about what it is. We said it is an aging process that a woman goes through between the age of 45 and 55 years. And it is caused as a result of depletion in the eggs of the woman. that causes reduction in the production of estrogen and progesterone in the body. Estrogen and progesterone play a vital role in the woman's body. It keeps our muscle full and healthy. It helps in digestion. It helps us when, in our muscles, in our linings of the organs, during urination and all that. It does a lot of things in the system. So if those hormones are reduced because of age, it brings out some health challenges. But it is not the end of the world. As a woman, we must learn to manage it. And if you cannot manage the symptoms, then you report to the hospital for counseling and then treatment. We talked about the symptoms. We talked about the hot flashes. The hot flashes that the woman suddenly will experience some heat within the body and want to take off her clothes. We talked about the tingling sensation in the toes and the fingers. You see as if you have some pins and needles pricking you. We talked about the sleepless nights, an inability to sleep at night. We talked about urination. You urinate frequently, especially in the night. We talked about the skin, how the skin becomes very thin, the elasticity reduces, it becomes saggy and wrinkled. And then you are unable to relate socially because you lose self-confidence in yourself because your body changes. You put on some weight, your reproductive organs are not spared, you have dry vagina, so you cannot enjoy sex. Your reproductive organ, your female organs outwardly will become small. It's not full anymore. I mean, it comes with a lot of manifestations, but it can be managed. For the sexual difficulty, because the vagina is dry during sex, the woman experiences pain. So the advice is that you use water-based lubricants during sex. You rub it on yourself and your man, and then so that you can enjoy sex. Also, for your dry skin, it's advised that you take in vitamin E or food rich in vitamin E. We mentioned flaxseed oil that can help in your dry skin, and then loss of hair, it can repair. But where the symptoms are not controllable, even with exercise, you are supposed to do exercise, at least walking exercise, 30 minutes every day, or 30 minutes every week, depending on your work schedule. I think will help you to manage your weight. But where you cannot, handle the symptoms, then you report to the hospital, and then you are put on hormone replacement therapy. We talked about the combined method that replaces the estrogen, both the estrogen and progesterone. You'll be given either by orally, tablets, or a patch or a cream to apply. The physician or the doctor or the midwife will show you how to use it to manage the pain, the symptoms. We have the estrogen only that we give to women without uterus. Yes. And then the progesterone only, which sometimes is given to women whose hot flashes they cannot control. Yeah. So generally, menopause, it's not something that any woman can escape when you reach that stage. But it is advised that you psych up your mind and embrace it. You see, when you know and you embrace it, it becomes easier to manage. It is when you don't know, you are ignorant, and then you are hit with it, then you are worried, you are scared of the unknown. So here we are, we know that it can be managed. It can be treated. So when you're a menopausal woman, know that there is hope for you. You can live your full life in comfort. And then our husbands too, it advised that you will know when your women hit their menopausal stage, they need to be encouraged. They need to be to feel loved. You see, you don't say words that will depress your spouse, so to speak. That will send her into depression, because she can quickly go into depression because she will not feel that she's accepted. She will feel like there's something wrong with her. You will have to learn to deal with the irritability and the mood swings. One of the issues is with the mood swings. The mood swings a lot. So we have to understand, our children must understand that when your parent, your mother gets to menopausal age, there are certain things she cannot control. So you will have to help her through it. So generally, that is it about menopause. Ebusianfo, Akwaba on Hill TV, program ni say healthy with Auntie Ness on this Hill TV. And then discussion ye kind menopause. Health issue na discussing here menopause. Menopause any processor obabia fame at a certain age as a after 40 kono ubetimi go into menopause at any time. And here discussing a DNA man menopause neighbor. The man neighbor ni say ye wo hormone ade bi wo ye body no ye hormone but ye nkosua na release a enema obani etimi living in life comfortably. But as unyino when hit 40 and over no egg no shrink tin ema hormone so reduce production ni reduce enti affect your body, almost the body parts. Enti effect ni say oh na a show all of a sudden we experience a show pa ebe ma wa yi watade nyina kra agu baby na open fan na AC to feel comfortable. I feel say ma junso in time kakra na junso deal menopause symptoms ne bi no wo ho so a otitimi pae o oti pae o, you know, o have kakra na obuefu your friend mood swing obo say obo nkomo fine big kakra pe na wasesa na obuefu and also ye menopause symptoms ne bi signs ne bi afi so sign mean say wa wudie no ko wase no and also a touchima changes back akra change ni say awudie na kasa no ebe moa ayeketoa na sebio uba monso no dry because nyankopɔ boy say o body ne ho no nkasa no ebe for most at times I keep it soft but who go into menopause ma dry enti ema oni ukonkra nya kentan ho a during sex no you don't enjoy sex because you are dry. Sometimes no amount of stimulation or arousal na say foreplay na ebe ma wa ho afọ enti I don't know I have advice say ube use your friend water based gel KY gel bi or your friend KY gel ni gel bi a odi be fefa ho na wetimi accept o okunu ena ya can say exercise do menopause so a man put it on kakra especially kesi you know about your phone around your waist and now to you know that place so you become heavy midsection until the ebema while to manage weight you know say obey exercise like obey call walk every early morning walk say 10 15 30 minutes a day ebe boa ama manage weight no na face wo didi fine didi duane green leafy vegetables like kontomire bokoboko and then those green leafy vegetables are will give you strength to live a quality life. calcium so benya o milk mu obenya o crab mu koto mu obenya a lot of bones, you know, bones, that's a meat, cow, goat, obenya calcium to duane should be rich or calcium, vitamin D so eboa na vitamin E, and so advice say obefa vitamin E o combine duane na wodi no so wetimi afa e ho supplement se na ebe ya ebe boa ama o skin no atoso fine enye that wrinkled because of lack of because of menopausal stage, you know. Na adia ba kon say wuntimi control symptoms na kwa and there was so doctor o ko hu doctor wa or the over two hormonal replacement therapy and a friend hormonal replacement therapy the hormone anka body anka sabe produce no ye be ma tablets ne se na be ya symptoms no be cough and be ma symptoms na cough and ye o different types combine estrogen ni progesterone and e estrogen kwa and progesterone kwa depending say who uterus and how new uterus and na say untimi control hot flashes and ye the be ma so generally speaking we na ene ye discuss ye menopause se na de ba and say na obe manage no enti ebusiafo ene program no ye de aba ewieye on menopause. Welcome to pese utie upe question be fa ho a frɛ 0244 30 093032 0244 093032 frɛ to see na me no be kasa I'll give you response to whatever question that you may have. Yeah, damasi. Yeah, next week by this time, you best study accommodate topic. Fine. But bani discuss it. That's it. Viewers across the globe, thank you once again for joining us on this session of Stay Healthy with Auntie Ness on Hill TV. Today we discussed menopause. We've gotten to know the causes, the symptoms that it comes with, how to manage it, and then how to stay healthy. Thank you for joining us. See you next week on Stay Healthy with Auntie Ness on Hill TV. Hill TV, stay healthy by proclaiming Jesus Christ. Bye-bye.
Join me, Auntie Ness, on Hill TV whilst we discuss health conditions, their causes, management, and prevention for a healthy living. You know your health is your wealth. Stay connected, stay informed.